Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to talk about herpes virus and cats. Herpes virus is a very common virus that we tend to see in cats, and it usually affects small kittens, so they tend to come in very snuffly, sort of upper airway problems. Oftentimes they can have very runny eyes. In some cases, the whole eyes, both eyes can be quite swollen up and inflamed. So it's very common to see that in younger kittens, and then as they grow older, they can still develop the condition because once you've had herpes virus, you're always going to have it. So it's a virus which you can't ever get rid of completely. The only thing you can do is trying to get it into a dormant stage. So herpes virus is everywhere. Humans have it, cats have it. They all have their separate types of herpes virus. And these types of herpes virus don't tend to go from one species to the next. So a type of herpes virus in a cat will remain in the cat population, and as a human, you won't be able to get that particular type of virus. But similar to humans, where a lot of people have herpes virus and then never have a problem with it, cats are the same. They can have herpes virus and never have a problem for their whole lives, or they may have herpes virus and start developing problems. The analogy I always have for this condition is cold sores. So if you have a cold sore, when you get stressed, it's probably herpes virus related. And then once that stressful situation disappears, and after a few weeks, that should settle down again. A similar thing can happen in cats, but in cats, they don't tend to develop these cold sores. They oftentimes develop runny eyes, corneal ulcers, and other problems. And it's usually triggered by stressful situations, and it can flare up whenever there is a stressful situation. That could just be a visit to the vet for a vaccination. That can be anything that a cat perceives as a stressful situation. If you're in a very busy household with multiple cats, and the cats are not comfortable with the current hierarchy that's going, you might see a flare up of that condition. Or if anything changes in household circumstances, that can again trigger a flare up of this condition and start causing symptoms. Cats with herpes virus usually infect themselves as they're going through the birth canal from the queen, so they don't pick it up later on in life. It's usually something that they have from an extremely early age. It's not impossible for them to infect themselves later on in life, but most cats have it from a very young age. Yes, so that's one of the key features of this condition, that it oftentimes affects both eyes, not to the same degree always, but we tend to see this mostly to some degree in both eyes. And sometimes it affects more than just the eyes. Sometimes they can also have other symptoms, upper airway problems, or skin lesions, or other problems as well. As they get older, they tend to cope a lot better with those other conditions, and it tends to remain in and around the eye, but it's still possible to affect other parts of the body. Not really. There's herpes virus, as already mentioned, can affect any cat at any stage, and there's not a clear breed predisposition for this condition. That depends on how severely the cat is affected. So if you have a patient who's got very mild symptoms, perhaps just a little bit of a runny eye, I wouldn't necessarily start treatment straight away, because the treatment is not going to get rid of that infection. It's basically going to just stop it or slow it down a little bit. However, if there are things like ulcers, or if the patient is really painful with the condition, then treatment is warranted. And you can do that in two ways. You can either do that with eye medications, or you can do that with tablets, or pastes, so oral sort of systemic medication. Eye drops, or eye ointments are very different to the human antivirals. So if you go to a human physician or a pharmacist and ask them for an antiviral cream, they will recommend acyclovir, which is the drug of choice for humans. But it's the least effective in cats. So cats need a very different type of antiviral. So in cats, we tend to use a drug called famciclovir or ganciclovir, which is the drug of choice for cats. We do have ganciclovir as an ointment available, commercially available, and famciclovir either as a tablet or as a paste is available, particularly if there are other systemic signs, or if the cat doesn't tolerate eye medications but still needs treatment. If a cat doesn't tolerate oral treatment but eye drops, then you would usually recommend using the ganciclovir ointment instead. Well, in some cases, herpes virus can cause some severe damage to the eye, and some patients have really bad ulcers and need that medication in order for things to start improving. But the vast majority, the ones that come in with just a bit of a runny eye and no other significant symptoms, um, may not even need treatment, and just leaving it alone might help things settle down. So it depends on the situation, it depends on the patient. So hopefully you found this video interesting, and if there are any comments or any questions, please feel free to drop them at the bottom. Thank you. Bye-bye.